is not just about the weight, but it goes beyond that.
The United Nations Children's Fund says one child.
So what is malnutrition? Malnutrition refers to deficiencies in nutrient intake, imbalance of essential nutrients, or impaired nutrient utilization. The malnutrition is not only about undernutrition, but also it consists of overweight, obesity, inadequate vitamins or minerals, until resulting diet-related disease complications. In underweight, it is usually identified in children, and even overweight and obesity it is identical to adults. In several countries, there are many cases of undernutrition such as stunting, wasting, and underweight. This case mostly occurs in African countries, India, Afghanistan, Yemen, and each others, and those countries are associated with poor countries. Many people think that poverty is the main factor of malnutrition. In fact, many people attribute poverty to the fact that some people don't eat, but this is more than that. That is, many people eat food without thinking about the nutritional content. Many people don't pay attention to other things that are more important in malnutrition. It can be happen in non-poor countries. Surprisingly, this also happens in developed countries, like in US and Europe. Many people don't know that US and Europe has high levels of malnutrition. Of course, this is not because of poverty which makes them suffer from malnutrition, but because they have an unhealthy diet lifestyle. Who doesn't know with their Western diet? They sometimes take it for granted. They usually eat junk food and didn't see the nutritional content in it. They don't even think about the long term of their diet. It is not because of poverty, right? US and Europe are developed countries and even can be said rich countries. As a result of this unhealthy diet, it is possible that most people there will have malnutrition disease. This lifestyle unfortunately is associated with serious disease like heart disease, cancer, diabetes, and obesity. Around 17 million people die because of heart attack or stroke per year. The cancer, which has a very large number of deaths too. Diabetes has also become an epidemic. 1 out of 2 Europeans and Americans is overweight. There are more than 600,000 people dead per each year in the US due to nutrition and obesity-related disease. Even in Europe, people who are hospitalized longer because of malnutrition, because need more intensive care. The cost of malnutrition in the UK is each more than 10 billion pounds sterling per each year. The total economic cost from 2011 until 2020 reached around 16 trillion US dollar in the US for this case of malnutrition, and around 173 billion US dollars spent on healthcare for obesity in the US per year. So, this problem of malnutrition is not just a global health problem, but it goes beyond that. Since also the number of deaths caused by malnutrition, and even this problem becomes a problem that can hamper the economy of a country. Behind all that, because in it there is also the human right to live and have the eligibility to get help, especially in terms of nutrition. So why is the problem of malnutrition so important and even dangerous for the country or globally? And that's why this malnutrition is being called a global security issue now. In Europe, the European Public Health Association said that the European austerity created a new tax policy on unhealthy foods, such as in Hungary a tax on junk food, in France a tax on soda, and Denmark in saturated fat. In France and Hungary, these taxes work. It intends to reduce the consumption of the type of food that is taxed. Another policies in Europe about include legislation on food information to consumers. Depending on the label, information is provided on nutritional content, on the origins of foods, and on health claims. From December 2016, nutritional information has been compulsory on all packaged food products. In the US, the United States Department of Agriculture and the Center for Disease Control and Prevention. One of the efforts to make the CDC Healthy Schools program work with states, school system, communities, and national partners to promote good nutrition. The international organization, like World Health Organization, also tried to pay attention to this case by continuing to conduct research with various organizations and providing assistance to implement policies from countries. So, who is more at risk? Anyone is at risk in terms of malnutrition, and maybe you could be more at risk. Then, what should we do? We have to start with pay more attention to the nutrition in our bodies, adopt a healthy diet, consume nutritious foods, and look at the nutritional content of what we eat. Then, making all of this to be our habit. All of this is not enough if we don't start from ourselves.